Good afternoon, everyone, and welcome. Thank you for joining us to today's presentation. I'm Tricia Riley, Chair of the Labor and Employment Group here at Merthyr Kalina. With me today are partners Sal Gangemi and Matthew Curtin. Most of you on the call know all of us, so it's great to see the list with so many familiar names. This is our third webinar on managing the COVID-19 pandemic situation in the workplace. Today, we will be talking to you about return to work issues that we've encountered since the reopening of offices and places of business. First, I'm going to take a moment to go over a couple of housekeeping items. All callers are currently in listen-only mode. We cannot see or hear you. We recommend setting your screen to gallery view so that you can see all three speakers throughout the presentation. We encourage questions for today's discussion. You can ask questions using the Q&A box on your Zoom control bar. This webinar is being recorded. All of today's participants will receive an email following today's presentation with a link to the webinar recording and an attendance certificate. So Matt Curtin is going to be our MC and host for the questions today. We thought we would start out with a few of our own to give you all a chance to think of your questions and follow up as we're talking. So we'll start with some questions that we've prepared that address things we've been seeing from our clients, and then we expect that you'll have some follow-up questions as a result. Over to you, Matt.
Good afternoon, everybody, and thank you, Tricia. This will be a little different format than we've used in the past. This is our third part of the COVID-19 webinar series at Merthyr, and you can all see us this time. There will not be any PowerPoint presentation. We're doing that on purpose. We want this to be more of a roundtable discussion. So I can see any questions that you submit through Zoom here, and I'll be moderating those throughout. But let's get started with some of our own questions. We're going to start with some basic questions just to get ramped up, but questions that might not be obvious. One thing I'd like to pose to Tricia and Sal is, now that we are returning employees to work, and for employers who have been open throughout the whole time, can an employer mandate COVID-19 testing of employees?
So I'll start with that question, Matt, and I look at the testing question in a broader range of potential health information that an employer may want to collect from an employee. So let's start with the specific question of mandating testing. The answer is yes. An employer can require employees to be COVID tested to come on site. For those clients on the line who run nursing homes or residential care facilities, they all know that the executive order in Connecticut required weekly testing as of June 14th. So the state has actually mandated testing for basically nursing homes, residential care, assisted living. So that is residential care facilities rather. So that is required. For non-nursing home employers, yes, an employee can mandate testing. I've had questions come in, for example, if our employees are on a construction site, can we mandate testing? Yes, you can. So, but I've also gotten questions about other kinds of information that employers may want to collect. Temperature checks. Can an employer check an employee's temperatures? Yes. How can they do so to ensure the privacy of the employees? So we've been talking around logistics. That depends on your workplace. Many employers, even offices, are requiring self-reporting. So you will email or text every day to a protected, confidential email address saying no fever, no symptoms, or just no. I've helped clients streamline that reporting process so that there's a record to show what the questions are, and the employee just has to text no or email no to a secure location. So there are a range of things that you can do and require of employees before they step foot on the work site. Sal, I don't know if you have anything to add to that with regard to your experience.
Sure. Yeah, and I do like the idea of having employees take their own temperatures and confirming that they're symptom free or don't have a fever. One of the concerns that that stem from taking temperatures in the workplace is then maintaining documents with information regarding the results of that, including any type of testing, and it really just creates more of a burden on you to make sure that information is kept secure. So that's essentially why I think this concept that Trisha's talking about really makes the most sense for most employers.
If an employer does take medical information concerning COVID-19 symptoms and documents that information, should that information go into a personnel file?
You want me to? I can take that. Well, first of all, it shouldn't go into the personnel file. The ADA requires that medical information be segregated from personnel files, and the reason for that is that you have a lot of people have access to an individual employee's personnel file. Not all those people need to be aware of the employee's medical issues or medical testing. Personally, I've been telling people not to keep that information and not to keep those whatever results they have to the extent possible. But if they do, they should be in segregated files and limited to employees who have a need to know. Again, not everyone who might have access to a personnel folder has a need to know what the results of a medical test are.
And to follow up on Sal's point about the ADA, of course, those of us who are employers in Connecticut know that Connecticut requires a separate personnel file and a separate medical file. They cannot be commingled.
Yeah. So what happens when an employee calls in sick right now? Are we advising that employees be proactive and ask about specific symptoms about COVID-19? Are we asking that employers have some sort of procedure in place so that employees that are taking these sick calls know what to say? What are we advising our clients when they ask about what to do if an employee calls in sick?
I can start with that one. So one thing is, let's not forget some of the general rules of employee management that, for example, the FMLA still applies, leaving aside the emergency FMLA. I'm not talking about that. I'm talking about the traditional federal and state FMLA for employers who are big enough. You know, if you have an employee who's out for 3 days, that person is eligible, may be eligible for FMLA, and you do want to designate this as an FMLA event. Now, if you generally require a return to work clearance, then yes, but you can also have, then you would require a return to work clearance for this situation. But you can have, and most employers now have policies specific to COVID-19 so that if an employee had had a fever or had an illness consistent with COVID, that would be a reason to require a COVID test and a 14-day quarantine before a person returns to the workplace. So that's a reasonable request for somebody who has COVID symptoms, that they have to self-quarantine and remain out of the workplace for the 14-day recommended period of time. In Connecticut, COVID testing is very easily accessible. I mean, I've had family members who had to get COVID testing for surgery or because they wanted to voluntarily, and it has not it's a very easy process. There's a drive-through process. It's minimally invasive. So I think that if an employer in Connecticut wants to require an employee to have a COVID test before returning to work, if they have COVID-like symptoms, to me, that's a reasonable request, and one that would be supported by federal and state guidelines. And let's, back up 2.5 months and recall that none of this would have been permissible under the federal and state guidelines. The world has changed, and all of this collection of medical information, personal health information, none of this would have been acceptable 2.5 months ago. And is this going to switch back when the virus recedes or a vaccine is found? It may, but at this point in time, all of the rules have changed. And so employers can collect this information because safety and health are paramount, in this pandemic environment.
What if an employee refuses a test? What if the employer asks for a test and the employee refuses to test before coming back?
Well, under those circumstances, the employer can prohibit the employee from coming back to the office. Now, one of the questions you have to ask is why? Why are you refusing this test? There may be reasons, there may be legitimate reasons for their refusal. That doesn't mean you let them in. Okay, that just means that you can determine whether or not they're being insubordinate. So, for example, there may be religious reasons for someone not wanting to take a test. In any event, if they refuse to take the test, they cannot come back to the office. And if there doesn't seem to be a reasonable basis for their refusal to take the test, it can be considered an insubordinate act. Under this current regime, or under this current system that we're dealing with. So at least that's my view. I feel that employees you can condition their return to the office based on these tests, provided that they don't have a legitimate reason, such as a religious reason or some other reason I can't think of right now, that would entitle them to refuse.
Well, Sal, it raises an interesting question. I don't think there is an accommodation for refusal to take a COVID test right now. So let's say that
Right.
you have some kind of psychological condition and you're really freaked out about having a swab a little bit in your nose. And so you say, you get a doctor's note to that effect. This is one of those areas, I think, where there's a bright line. You can't accommodate a disability that would prohibit somebody from being tested if that's your neutral workplace rule. So then, the question becomes, can you terminate that person, or do you have to put them on an extended leave of absence? But then there's no reasonable return to work date as long as this pandemic continues. So probably they're going to get terminated and collect unemployment because they can't, or they refuse to take a test. And I don't see any basis for religious accommodation in this environment at all, And so that's where the accommodation laws are so interesting, because they are, on a continuum. And again, we've never, ever in our lives had this situation where the public health is paramount. And that really supersedes a lot of these other considerations. But let's talk about the ADA and accommodation issues with regard to working with COVID patients, right? So for a lot of our clients on the line, they're healthcare providers in some way, shape, or form, or assisted living or nursing homes. And there's a lot of requests for accommodation with regard to working or not working with the COVID population. And there's been these clients have had to address those issues and try to accommodate. At least I've been advising go through the interactive process, because sometimes there are accommodations in that regard. So that's, another interesting thing. I will say another thing I'm seeing with regard to accommodations is in non-healthcare or non-assisted living or nursing home facilities, my job has changed. So many employers on the line will have maintenance crew or maintenance staff. And what if you get somebody who's got, terrible asthma, and that person says, I can tolerate being outside and mowing the lawn, but I cannot tolerate being inside and working with the chemicals. how are you going to deal with that issue? Is that a medical accommodation that you have to be able to accommodate? Does it create an undue burden for your staff? Because, for example, if you're an independent school and you have a small maintenance staff and, there's only 2 people and one of them can't, work with the chemicals needed to, sterilize the environment, what do you have to do there? And again, we go back to the, black letter law of the ADA is it's a reasonable accommodation. But maybe you can't give a reasonable accommodation in this environment where you're so short-staffed, and now cleaning has become an essential function of these maintenance jobs. So I'm seeing this evolution of job duties. Many people's jobs have changed, and the duties required in those jobs have changed as a result of the COVID situation.
So we do have some questions. Let's take one of the audience questions right now. And this is concerns what we were just discussing, testing. And so if an employee submits a test result to the employer, to whom should the employee submit the result? Should it go to HR? Should there be I think that the point is, should HR document this somewhere? And I think Sal's recommendation was no. And the question seems to be, should the employees just let us know that they are clear? I'll start the answer to this. I think what we're getting at is you should have a reporting process. This shouldn't be a situation that hasn't been thought out ahead of time. We're advising that you designate an individual or individuals that are trained on how to ask the right questions, on how to be discreet about conducting the testing, about how to maintain confidentiality of testing results. And to the extent that you are documenting results for whatever reason you might have, that the individual knows how to document those results in a separate medical file that has need-to-know access only and is not accessible by the general employee census or even HR individuals that really don't have any need to know about the confidentiality of medical information. So I think that the recommendation is to just make sure that you have a process in place that works for the size and scope of your operations. Generally, we don't think it's necessary that you record the information if you'd like to. There are some circumstances that you would do that. I'll talk about one of those in a second, but you just have to make sure.
Let me chime in there because I think I might have a slightly different view. I think it depends on what we're talking about. I understood Sal to say earlier that you don't have to record or keep or maintain, self-reporting records. I don't know if that's, I would agree with that statement. So if we're talking about, emails or texts on a daily basis, run of the mill, where people are saying, no, I have no symptoms, therefore I'm in the office. I don't think that's something that you have to maintain. I would maintain a record of a negative COVID test because you want to, as the employer, be able to show that you only let that person in after they had the negative COVID test. So I would maintain that in a confidential medical file. And I totally agree with you. It's best to have a designated person for this. It can be an HR person who is the keeper of the medical records. You could have a separate medical record COVID related file so that not everything for this person is intermingled in one medical file.
That's right.
But I would definitely keep any medical records related to a COVID test that was required because they had symptoms, or return to work clearance because they had symptoms. Now, if you're a hospital, we have this with some of our hospital clients, the HIPAA issues between, say, an employee health doctor and an HR, those still have to be maintained. And so if you were going to get the information, you get it directly from the employee and or from the employee's physician with a HIPAA compliant authorization. But it's important to keep the records for related to COVID, unless it's just a run-of-the-mill reporting that I don't have any symptoms. You can keep those or not keep those. But that's my view of the document retention situation.
Yeah, so that answers the first question. Then we had a second question, and I think that the same person followed up to clarify. I wasn't answering Glenn's question, I was answering a different question. But Glenn is asking if you're asking at the front door, just screening about symptoms, should the person at the front desk that's screening for symptoms be keeping records? And it looks like the hypothetical here is that the employer would have a checklist, and that the front desk person would run through the questions on the checklist and check off yes or no. And depending on the answers to the questions, the employer would either let the employee in or tell them to go home for the day and possibly self-isolate. So the question there is, do you keep that checklist? And if so, what do you do with it?
So my view on that, so two things. One thing I would recommend is, if you can do all this electronically, I highly recommend it. It preserves confidentiality. If you send the list of questions ahead of time to employees so they know what they are and they have to self-report on a daily basis by, again, email or text, we've done that for many employers, and rather than have people stop at a reception desk and have a discussion in front of other employees, my recommendation is do it electronically, and then what the receptionist is doing is just checking off a list of people. Joe responded, Mary didn't respond. If Mary didn't respond, she doesn't get to come in the office until she completes, the questionnaire. If for some reason you cannot do this electronically in your workplace and you have to have an interaction of that long a discussion or nature with your receptionist and employee, I think you have to be really careful about, the receptionist has to keep the information confidential. If a person arrives with symptoms, that person's going to have to be turned away. You have to think about, where are we doing this? Who's going to see it? How is the information being shown to other people? Even if we're not showing the actual documentation, other employees may see somebody walk out and they're going to assume that it's because they reported a symptom. So I think, just as a really fundamental principle, you have to think about the logistics of how you're collecting this information. Then you get to the next level question of, what do we do with the information once we collect it? And that's, if somebody has symptoms, I think you need to retain that information. I'm less concerned about retaining information for non-symptomatic people. The reason you retain the information for symptomatic is that, now is that person going to be required to go out for a certain period of time? And then you also, the really critical thing is, the receptionist's job is to say who's in the office that day. Because ultimately, if you get a COVID positive, you may have to do contact tracing. And that's why you want to know who was in the office. So I think a lot of these questions, you just have to really think through the logistics of, what's the best way for us to ensure that people coming into the office, don't have symptoms. And again, I highly recommend an electronic way of doing it, because I think it's the least invasive and the most protective of information. If you have symptoms, you are not allowed in the office, and just or the workplace.
So I think that that's a good segue into an example of what I really think is the baseline here is preparedness. And as an example, tomorrow is June 17th. June 17th marks the next phase in what has been characterized as reopen Connecticut. So there are very specific sector rules for the June 17th reopen. Those can be found on the Connecticut DECD website. We're not going to have time to go through all the sector rules, but for employers that that are restaurants, hotels, personal services, hair salons, barbershops, indoor recreation, all those types of employers should review the sector reopening. Manufacturing, construction, real estate, utilities, for the most part, have been open all along. Restaurants have been kind of open since May 20th and outdoor only and no bar areas. Starting tomorrow, restaurants will be allowed to have indoor patrons at 50% capacity with some very specific sector rules. And that goes for the same for hotels, lodging, gyms, sports complexes, libraries. But if you read through the sector rules in the June 17th reopening plan, it's really keyed off preparedness and making sure, for example, that you have a program administrator that oversees the reopening of a specific workplace, making sure that there's robust employee training. And what will that look like? Well, it's going to be different depending on the type of employer you are, the size of employer, the scope of your operations, your physical location, the size of your physical location. All those issues those are the kinds of issues that Sal and Tricia and I are working through with clients to make sure that there are specific preparedness plans in place, whether it's a reopening or just a maintenance of staying open during the pandemic. But on a continuous basis, we're examining the preparedness plans and making sure that they're working, and we're adjusting where those preparedness plans are not working. So in preparation for that June 17th reopening, if you are on that list as a sector that gets to reopen tomorrow, make sure that you review the sector rules for the June 17th reopen. You're going to be looking at 50% capacity, strict cleaning and disinfection protocols, allowing employees to continue to work from home if they have the capacity to do so and the ability to do so. Connecticut continues to recommend that individuals in high-risk groups and individuals over the age of 55 stay home. They're saying stay home and stay safe. Now,
So,
as employers,
not to interrupt, but yeah, Sal has read up on those rules, right?
So,
that's a segue into the next issue is, so if Connecticut's recommending that individuals over the age of 65 continue to stay at home and stay safe, as an employer, Sal, can we mandate as employers that individuals over the age of 65 not come to the workplace?
Right. So see, that's the conflict, because in addition to the state mandates or the state directives and guidance, you also have the CDC saying that people in high risk categories shouldn't go to work, which could lead you to believe that, hey, so I can, be a good employer, a benevolent employer, and tell these people they don't have to come in. Just the other day, the EEOC issued some guidelines on this, and essentially, what they basically came down and said is, you can inform the employee who may be in a high-risk situation, and you may not know if they're in a high-risk situation, although you'll know you may know if they're of a certain age or if they're pregnant. You can let them know about the high risks involved, but you cannot make the decision for them. You cannot, that's viewed as somewhat paternalistic, and you have to allow them to make that decision as well as to whether or not they want to continue to work. That sort of same reasoning applies to caregiver discrimination as well. You can't assume that, for example, someone who's asking for time off, let's say, because they have child care requirements, you have to treat men the same way you would treat women. And you can't make generalizations regarding their need to deal with child care issues. So the short answer, after I've just gone through all that, is that you cannot prevent a pregnant employee, or any employee for that matter, from working unless, of course, they have symptoms, or they're manifesting symptoms that could pose a direct threat to the other people in the workplace.
Sal, we have one question here.
Yes.
The question is, should an employer seek out information from employees concerning whether they are in high-risk categories? So should the employer be proactive?
Well, I think it's important. I think employers should be proactive in terms of trying to figure out to what extent an employee is comfortable about coming to work. I don't believe that the employer, and in fact, I'll say not to do this. The employer should not be soliciting information from the employee regarding any underlying medical conditions that they might have. So I would say no to that. But you can invite employees in a way. You can invite them to sort of make whatever disclosures they feel comfortable making without you actually asking them. I think it's important for you to assess who's concerned about coming back and who's not. You don't have to, but I think it is a good practice to have. And then from there, if you need to, if you need to enter into the interactive process or the interactive dialogue regarding an accommodation, you can do so. But you can't come out and ask this sort of information of an employee. It's really, as far as I'm concerned, and I think as the law is concerned, it is a prohibited, it would be considered a prohibited inquiry.
Mm-hmm. Yeah, I'd agree. I wouldn't seek out that information unless you have reason to believe that there's an issue that you need to address with the employee. And sometimes that happens with medical issues and it's obvious. But we urge a lot of caution in those situations, because when you, as an employer, seek out that confidential information, often it sets the stage for a discrimination or a retaliation claim. So I'd be very careful.
On that issue too, in terms of where are we now? I mean, offices reopened on May 20th. So it's a little bit, it's been about 3 weeks or so. And it's almost a month. And so what are we seeing in the offices? What I'm seeing is no one's coming back to work, because
it's true.
Any office, so it's kind of like an issue, non-issue. So, this question of, so I helped certain offices develop their return to work policies and procedures. And so the way we dealt with this issue of the state guidance and the CDC guidance on age and condition was to say, the office is reopening, you're able to come back. Attached is guidance for your review and consideration, for you in making your individual decision as to whether or not to come back. But if somebody is 66 and they say, no, I can't stand working at home, let me back in that office, they're coming back to the office. So I think, and then the other thing in terms of our discussion of eliciting information, no, you don't want to go to a particular person. But again, to Sal's point and your point, Matt, that if we want to assess who's coming back or, get a feel for who's coming back, many employers went ahead and did surveys. They set up Survey Monkeys to get that information. Now, many of those places are open and they're seeing that a lot of people who were able to work remotely continue to do so. But many of our clients have operations that cannot, where you cannot do the work remotely. And so therefore it's now a question of, we're bringing employees back. Our PPP has expired. We're reopening. How does that work? And one thing we're seeing is some people don't want to come back because they're afraid to come back. So This is not a medical issue. This is not an age issue. This is, I'm just afraid to come back to work. If that's your only reason for not coming back to work, that's not a good enough reason.
Right.
But the state of Connecticut has, as many of you may know, broadened the category of employees who will receive unemployment if they cannot come back to work because they have a family member who is vulnerable. So for example, if I live with my 85-year-old mother and I have a job as a receptionist in a healthcare facility, and I say, I do not wish to come back to work because I'm concerned about my 85-year-old mother, you as the physician's office can say, well, I'm sorry, we can't accommodate you, but we're going to have to lay you off. However, that person will receive unemployment because now your job that you're offering them back is not considered suitable work.
Mhm.
And then I think we need to address also how that plays into the PPP reimbursement. So let's say that you had a person that you offered the job back to, and they can't come back because they have a vulnerable person living with them. So then you say, well, we can't accommodate you. We're going to terminate you, lay you off, you're going to get unemployment. My understanding, correct me if I'm wrong, is that that person can still count toward the PPP headcount because you did
Right.
for them the job back, right? But are there some steps that the employer
Well,
should take to ensure that they're counted, Sal?
Right. Well, so the interim rules on this, the temporary rules on this, require an employer to notify unemployment within 30 days of the employee's refusal to come to work. Now, that's something that's required in order that you don't get penalized under the PPP for not having adequate FTE in the workplace, full-time employees in the workplace. So it is something that you're to do. Now, the problem with that is that most states, and I could speak for New York and Connecticut on this, most states don't have a mechanism in place to sort of get these inquiries. They're supposed to be, so for example, the temporary rules say that they were going to publish every state's special fax number or email address where this could be, where this information could be sent. And that no one set that up yet. Well, at least the temporary rules haven't been amended to reflect that. So it's not clear to what extent it's going to go smoothly. I have advised clients to tell employees who refuse to come back out of this generalized fear of catching COVID that you could let them know that you may not be entitled to unemployment under the circumstances. Generally speaking, unless someone is in imminent danger of contracting COVID-19, the mere fact that it's possible that they'll contract it wouldn't be enough to excuse them from the workplace.
This kind of leads me to the issue of how safe is your workplace and what is OSHA doing? OSHA's been a little bit quiet in my view during the last 2 months. I have had some clients get surprise OSHA visits and they've been in compliance because the guidance is pretty easily accessible and people know how to comply with it. Are we seeing any new guidance, OSHA guidance come out that can help inform employers on what safety measures they should put in place? Has anybody seen anything recently?
I haven't seen anything recently except that OSHA is requiring employers to basically determine whether an employee who's contracted COVID-19 contracted it in the workplace. So that's something OSHA is pushing. They did come out a couple of days ago to say, look, we understand that may not be possible for some smaller employers, so we're not going to enforce it. Which leads me to think, so then why are you saying anything in the first place? But I think as a general proposition, that's something they want you to attempt to do. Now, initially, this was just limited to healthcare employers or essential business employers, but now it's being extended. It's been extended to all employers. They're not even requiring you to. They're not even requiring OSHA is not even requiring that all employees in the workplace wear a mask, which is interesting. It's only under limited circumstances do they require you, an employer, to permit an employee to wear a mask. So really, you have these different agencies who basically, have positions that might conflict with other agencies. But it's just a matter of, they have their turf and what it is that they're worried about. So really, you need to look at what the CDC is saying, what OSHA is saying, what your State Department of Labor is saying about these kinds of things. And it can get burdensome, that's for sure.
And you know,
Yeah,
I had this sort of as an esoteric question. I was having this conversation with somebody the other day in Connecticut. A lot of this guidance is by executive order, right? They're
Right.
really, I mean, what happens if someone violates an executive order? I don't know what the consequences. Maybe they could shut down your business. You know, that might be a possibility. But an employee is not going to have an individual employment claim against an employer necessarily, but it could be a factor that goes into whether the employer acted responsibly, kept a safe workplace, you know, those kinds of things. But in Connecticut, my view is most employers are complying with the executive orders because they're reasonable, and the whole point, and if people understand the point is safety. And unless there's some compelling reason or medical reason why somebody can't comply, and then in that case, you have to explore whether there's an accommodation, and there may not be, in which case they get, you know, a leave of absence, or they get, you know, furloughed, or they get laid off, depending on the circumstances.
Mhm.
So, I mean, it's kind of, so Matt, do you want to take on, we haven't addressed yet, what happens when somebody tests positive and you know that someone has tested positive in your workplace? What is the current best practice for addressing that?
send them home. That's the first thing you do. If they're at work, make sure that you send them home. And now, if somebody does test positive, this goes back to what Sal was discussing with OSHA, and OSHA did release interim guidance a few days ago. It's pretty recent. It's a memo, May 19th now, an enforcement memo concerning employers' obligations to investigate whether or not an employee's COVID-19 positive test is work related. And so now employers that are subject to OSHA, which is generally all employers with 10 or more employees, and I think that this guidance applies even more broadly than that, employers need to make a reasonable investigation into whether an employee's COVID-19 positive test is work related, and the employer needs to basically do a mini inquiry. It's kind of like it's a little workplace investigation that can have serious consequences, because the standard is whether or not it's more likely than not that the employee contracted COVID-19 at the workplace. And if the employer's investigation shows that, yeah, it's more likely than not that the COVID-19 test, that the employee contracted COVID-19 because of the workplace, then you have to actually record the incident as an OSHA recordable incident. So what evidence does an employer need to look at? Well, COVID-19 illnesses are likely work-related, and this is according to OSHA, when several cases develop among workers who work closely together and there is no alternative explanation. That's one of the factors that OSHA is going to ask employers to look at. Whether an employee's illness was contracted shortly after lengthy close exposure to a particular customer or coworker who also had a confirmed case of COVID-19, and there was no alternative explanation. COVID-19 illness is likely work-related if the employee's job duties include having frequent close exposure to the general public in a locality with ongoing community transmission, then there's no alternative explanation. It's likely not work-related if the employee outside the workplace closely and frequently associates with somebody who, 1, has COVID-19, 2, is not a coworker, and 3, exposes the employee during the period in which the individual is likely infectious. So now HR professionals have this added burden of conducting these OSHA investigations into whether COVID-19 is work-related, and HR needs to make the determination based on the balance of these factors, whether or not it's more likely than not the employee contracted COVID-19 at the workplace. So that's a pretty onerous and difficult thing to do, and with no lead time in adjusting to those types of investigations, OSHA dropped that on employers. So that's something that's out there. I think it's going to be difficult for OSHA to enforce, but it is their enforcement position right now. So let's look at, these are very specific questions that we're getting now. Okay, there's several of them. I'm going to go back a little to what we were talking about testing at the workplace. And I didn't get around to this question, but here's a question for Sal and Tricia. If we are not set up to take electronic responses for questions about symptoms, can we as a procedure have an employee self-check at home and keep a record and be responsible to stay home and consult a healthcare provider if they are exhibiting COVID-19 symptoms?
Yes, you can have a policy.
Yeah.
That's a good idea. So here's your policy. You have a written policy telling all employees, here are the rules. If you have any of the following, first of all, you are required to take your temperature before you come to the office every day. If you have any of the following symptoms, you cannot come to the office and you must stay home and, until you're symptom free. And therefore, if you come to the office, we are going to trust and, not assume, but know, because you tested yourself, that you do not have any of those symptoms. So you can make it a condition of them coming to the office or the workplace and have each person sign off on the policy. I mean, if you don't even have an email way to communicate with people, then I don't know how you're going to communicate this policy to them before they come into the office. But assuming that you have basic email and you can distribute the policy and have them confirm, that would be a good way to do it. Or you mail, I guess you could mail the policy to their homes in hard copy, before they come back into the office, and make sure that you received a signed copy back before they could come back into the office. But the point of it is, you told them this is the requirement, you have to do it at home. And so that's going to be protective of you as the employer, that this was our policy and procedure. We told them to do this. They understood, they signed. Here's a copy of the policy with them having signed it. So therefore, if they're in the office, they're symptom free. That's perfectly fine. Then you don't have to have a screener every day screening them. Some employers don't trust their employees enough, or they just think they'd rather know for sure before they step foot on the premises. And if you do that, it's logistically difficult. You have to figure out where you can do it privately, where you can do it to maintain, confidentiality. This way, you are putting it on the employee. They can only come to the workplace if they basically complied with your policy. Look, if somebody leaves their house in the morning and they're fine, and during the course of the day they develop a fever, okay, those things happen. Then, to Matt's point, that person has to leave the workplace. So that would be part of your policy too. If during the course of the day you develop any of the COVID, symptoms, then, we would ask that you leave, tell your supervisor, manager, HR, whatever, leave, and you would take, the appropriate PTO for that time off. So, or the sick leave policy, the emergency sick leave could apply under those circumstances too. We haven't, reverted back to that, but we all know that for certain employers, the sick leave, emergency sick leave would apply. That is non-healthcare type of employers, for generally speaking.
Hey, so here's a good question from the audience. What if a 30-year-old lives with his or her 65-year-old parents who are relatively healthy? If the employee is concerned that he or she may bring the virus home to them, is that a legitimate reason not to return to work, and I guess separately to also collect unemployment?
So, okay. So let me take the first part of that. So, because really it is, the issue is distinct, whether or not it's, for example, a reason to terminate someone for refusing to come to work because of that, or, and whether or not they're entitled to unemployment. The fact is that whether and I've had this issue coming up countless times where people are saying, I'm not going to put my elderly parent at risk by coming into the office. And the fact is that you don't have to accommodate that employee, whether they live with someone who is, who is 65 or over, whether they live with someone who is pregnant. You don't have to accommodate a person and exempt them from coming to work because of that. Whether or not the ADA and the state laws on disability discrimination don't require you to do that. You know, they prevent you from discriminating against someone who associates with a person who has a disability, but that does not apply to reasonable accommodations. Now, whether or not they can get unemployment, as Tricia said earlier, in Connecticut, it looks like someone like that would be able to get unemployment. In New York, for example, the state hasn't spoken on something like that, but my suspicion is that that person would likely get unemployment. One of the things that I think is very important is that you not opine or give your opinion to the employee as to whether or not they will get unemployment. They would get unemployment under one of these circumstances. I always tell employers to say, yes, if you want to encourage an employee to come, but the employee is thinking, hey, you know what, I could stay home, be safe, and continue to collect unemployment. I think you can certainly tell them, look, I'm not the Department of Labor. We certainly, the company can't decide whether or not you'll get unemployment. But just so you know, you may lose it under these circumstances, and essentially leave it at that. But I would definitely not inform employees that, for example, well, look, you know what? We can't. If you want to stay home with your parents, that's fine. And by the way, you can collect unemployment under those circumstances. I would never, that's not something that I would ever advise an employer to volunteer in that type of information.
So the way that I frame it is, well, we can't accommodate your situation. I understand that you don't feel safe to come to the workplace because you're with parents in the age category that you've described. So we're going to lay you off, and you're free to apply for unemployment. Here's your UC-61 form. And from what I'm reading, I agree with Sal. You are not going to tell an employee whether they're going to get it or not, but you certainly say to them, you may go ahead and apply for unemployment, because in Connecticut, they're getting laid off, they can apply for unemployment. And again, this is the part I would not share with the employee, but the guidance, the executive order in Connecticut expanded the definition of what is not suitable work. And if you're living with a person in the age category, you as the employer don't get to have a discussion with your employee about, well, your parents are in good health and they're only 65, what's the problem? That's not how it works. If they're in the category and the employee is saying, I don't want to come to work, you can lay that employee off, they can apply for unemployment, and under current Connecticut rules, they're probably going to get it. There could be other reasons for them not getting unemployment that you don't know about. That's, to Sal's point. But in that scenario, you don't have that discussion. Now, I will say this, my understanding is the $600 supplement is right now, the current thinking is it's not going to be reinstated after, I believe it expires at the end of July. A lot of employees right now are making more than they make at their jobs. So there's a high incentive not to come back to work. I think once unemployment normalizes back to regular levels, which is less than full-time salary, people might want to start making money again. And there might be, we don't know how the pandemic is going to change, or people, has it, continued to go down? Or is there a vaccine? All that is going to change the environment in the long term. In the short term, you're still going to have a lot of people who don't want to come to work, and they may get unemployment. Many of these people are likely to get unemployment. Now, that all begs the question of, there's still a backlog in Connecticut, and there's still people having real difficulty obtaining unemployment, but that's a whole other issue.
Yeah. So somebody followed up with a question that said, why would we lay someone off in this situation? I thought a layoff is only for jobs that you are not replacing. Well, first,
you could furlough. So let's just talk about terminology. So you could furlough someone. In other words, if you think you're going to want this person back, a furlough, generally speaking, is a shorter term, usually 6 months or less. An idea that you probably are going to want this person back. So you could say to somebody, okay, well, you can't come, you don't want to come to work right now. We'll furlough you to see how things look, and we'll stay in touch.
Yeah.
A layoff is, basically you're terminating the person. I call it a layoff.
Nicer.
That's really a loose use of that word. It's a
Right.
termination. You know, we're terminating.
It
Layoff
is.
is kind of a softer landing. And,
That's-
right? So, I mean, the terminology, you know, is kind of intermingling. A lot of, initially in the COVID situation, a lot of employers were doing furloughs. In other words, because they fully anticipated that they were going to bring their staff back at a certain date, although that date could change, and they were maintaining health insurance benefits for those employees. So that
Yeah.
was a big difference between a furlough and a termination.
Right.
Employees are still doing that. No, if you think you want to bring this person back who's saying that they can't come back right now because they're afraid, sure, you could say to them, okay, then, you know, you can go, you know, furloughed, and we hope to take you back at a time when you feel safe to return. I mean, functionally, it's not a big difference because under both scenarios, they're going to get likely to get unemployment, although you're not going to tell them that.
Yeah.
Right. Legally speaking, there's no distinction. What you call it.
I think, well, yeah. So sometimes those furlough and layoff get the lines blur.
Mhm.
And again, you don't have to lay the person off. If somebody is uncomfortable coming back to work right now and you don't want to lay them off or you don't want to furlough them, you don't have to. You're not legally compelled to do so.
Right.
We're giving you your options. Some employers are more generous and will allow different arrangements for certain employees. But one thing I'll caution with that is you got to make sure that you're aware of potential discrimination landmines. So if you treat a certain employee more favorably than another similarly situated employee, you might be creating risk and laying the groundwork for a disparate treatment claim based on some type of protected category, whether it's disability or age or gender. Take your choice, but you just have to be aware of those discrimination concerns. You can't, especially in this pandemic situation where lots of people are losing their jobs and they're hard up for cash. You know, we're already seeing a spike in demand letters, requests for separation pay, allegations of disparate treatment and layoff situations or reductions in force. So you have to be really aware of potential discrimination situations if you're going to treat people more favorably than you need to. So let's talk a little bit. Well, actually, this is a good question following up on that. And I'm not sure this is the, let's see, do we lay the person off? So do we terminate the person or do we treat them as quitting? We have a job for them, but it's their choice not to come back. So I guess the question is, can we defensibly or colorably characterize this as a voluntary resignation if an individual refuses to come back because of vague concerns of contracting COVID-19 or infecting somebody in the household that is in a high-risk category?
You could characterize it as a resignation if you'd like, but I don't think you're going to win at the Department of Labor.
For unemployment purposes.
Right.
That's right.
But maybe if in a discrimination situation, maybe if there's a failure to accommodate suit or a age discrimination lawsuit, that could be a reverse age discrimination lawsuit. Because remember, in Connecticut, it's not 40 or over. There can be reverse age discrimination in Connecticut. I think it would be a stretch in this situation, but still, you know, desperate times call for a lot of crazy claims. So yeah, you could certainly characterize it as a voluntary resignation. I think you could defensively do so on the UC 61 form and any related unemployment paperwork that you need to fill out. But just make sure that you're consistently characterizing these types of separations so that you're not creating any discrimination concerns. So I want to talk a little bit about masks, and so just so everybody knows, we're going an hour and a half today just because our last two seminars ran over by about a half hour each. So continue to submit your questions and I'll try to get to all of them. But I do want to talk about face masks and cloth coverings because it really is, it's topical, it's creating problems in the workplace. So first of all, we'll start at the very beginning. Can an employer require an employee to wear a face covering in the workplace? Sal?
Yes. Yes.
Tricia?
Yes, and
Yeah.
employer can require an employee to wear a face mask in the workplace. Interestingly, an employer can refuse an employee's request to wear a face mask, which is actually the opposite of that, which is the position that OSHA takes. But yes, you can require an employee to wear a face mask. Now, one of the issues deals with someone, and this was discussed earlier when Tricia mentioned it. Some people medically might not feel comfortable wearing a face mask or are unable to wear a face mask, but the EEOC and OSHA have provided for alternatives in those situations. So, for example, a clear face shield might be able to do the trick under those circumstances. Where someone's not able to wear a face mask for whatever reason, a clear plastic shield might suffice. So that would be a way, I guess, of accommodating somebody in those circumstances.
So it's not only the case that employers can require some employees to wear face coverings. It's also true that in the state of Connecticut and in other surrounding states, there's sectors where employees need to wear face masks, and especially in public-facing businesses, retail businesses, restaurant businesses. When hotel and lodging begins to reopen, employees will be required to wear PPE. So in Connecticut, again, there is the requirement that an employer provide PPE, such as a face mask or latex gloves in the restaurant industry as these industries start to reopen. So you need to be very aware of your sector-specific rules, depending on what type of business you have. One question I have for Tricia, though, is we're seeing reports of employees wearing inappropriate face masks. Maybe they have political insignia and it's causing controversy in the workplace or fights. Maybe it's just in bad taste. Maybe the face mask just doesn't flow with a certain type of uniform that an employer has. Is there any way that employers can put up some guardrails around the types of masks that employees can wear in the workplace?
Yeah, so I've seen this issue. Starbucks had some negative publicity initially on this and then switched its policy with a Black Lives Matters mask situation. And so what I've been saying to employers is this: first, check your workplace apparel policy, your dress code. What does that say about what people can wear? Often the mask situation will be resolved because it's already addressed with caps or t-shirts, and it may say no logo t-shirts, no logoed apparel of any type. So if you have this issue, first check your dress code policy. Then ask yourself, have we been enforcing this dress code policy uniformly? So in other words, if you have a no logo dress code, but you've been letting people wear, and there's no exception for sports teams, and you've been letting people wear sports teams apparel, do you really want to start with a mask that says Black Lives Matters, for example? Probably not. So the question is, look at your policy, ask yourself, how has it been applied? Has it been uniformly and neutrally applied consistently? Then say, okay, this may not really be addressing, if it's not addressing the mask situation, you can create a specific mask dress code, mask policy. But again, be careful about how it's being implemented. So if you're creating a policy to react to the person who wears a political mask in the workplace, and you haven't previously enforced a dress code policy that also addresses political speech in the workplace, that's probably not going to be the best way to resolve it. On the other hand, if you now have people, many people wearing competing political masks in the workplace, you might then need to say, okay, across the board, we're going to now say no logoed masks, no this or that. You can make exceptions for neutral things like, okay, except for the sports teams if you want to do it that way. But I think the political situation right now is one in which there may be masks that have certain kinds of, political positions on them. And you have to really tread carefully because you can't single out a certain political statement unless you've consistently applied this policy. And also you have to look at, the language on a case-by-case basis in terms of if it's really, offensively incendiary to a certain group of people, like a Confederate flag mask. I mean, I think you can, say that's not allowed in our workplace. But the political statement on a mask is a really nuanced analysis. You have to be very careful when you're dealing with that.
Same goes, Tricia, same goes for unionized workplaces. And I know you and I, we've had the discussion about whether employers could ban face masks with union insignia. I think that you have to look first. First of all, generally the answer is no. The presumption is that generally employers cannot ban the use of union insignia in the workplace. There's a limited exception. It's a very narrow test. So I think you would have to basically apply the existing test concerning whether a handbook or an employee policy could prohibit the wearing of union insignia. Now, there's certain limited circumstances where that'll be allowed, and if it's causing disruption in the workplace or it would exacerbate employee dissension, but it's a very narrow test. And so you want to be careful that if you're telling employees to take off their union insignia, if they have a button on their mask or whatever, if it's just a straight up union mask with their insignia, you're going to have to make sure that you treat it as any other union insignia that they might wear in the workplace.
Right. Don't single out certain kinds of insignia, logos, speech, unless it's really so uniformly offensively provocative that it clearly violates your policy. But otherwise, and I hope everybody here has a policy, and again, it may not be specific enough to masks, and then you're just going to have to figure out how to roll out a mask policy. If you haven't had this issue yet, now's the time. If you want to make a policy, do it before you get the issue.
What if somebody refuses to come back to work and they just don't have any risk? That somebody wants to know, can that be considered voluntary?
If they what?
There's no risk at home of contracting, no high vulnerability individuals.
Right.
Again, that's not a legitimate basis to refuse to come to work. Under those, that person gets fired.
Yeah, so that could be fired, but if you want to say to me is a more defensible voluntary resignation. That's like the fear factor. That's somebody who's just afraid without any good reason, or I just don't feel like I'm making more money on unemployment. And I've said to employers, I've gotten this, and I've said, if an employee says, I don't want to come back, and they don't have a good reason, you are going to report to unemployment that you've offered them their job back, and their unemployment is going to be terminated. So tell the employee that and see if that changes their mind. If it doesn't, then you can say, okay, well, that's fine. I'm going to consider this a voluntary resignation, and we're going to mark it as such, and we're going to report to the Department of Labor, and nice knowing you, so you're going to part with that person one way or the other. I think it's more problematic to consider it a voluntary termination when somebody has a legitimate reason, including, and under the current state law, living with somebody in the vulnerable age bracket is a is a reason not to go back to work. So in that case, it's a little more difficult to call it a voluntary resignation because I mean, yeah, they're voluntarily resigning, I guess, but they are still going to get unemployment. I guess that's what I'm trying to say, that you could characterize it as such, but it's just not going to have the same impact as a true voluntary resignation, which is going to deprive the person of unemployment.
Well, here's a question to follow up on that line of inquiry. Should an employer be asking employees why they don't want to return if the employee is not offering a reason? Should the employer proactively ask the question?
I think the employer should ask why they don't want to come back under those circumstances. I mean, I think that's an important question to ask. I don't believe, you know, but I don't see that. I don't see it coming up as much as someone who basically is telling you they don't want to come back, you know, for X reason. But I don't see any problem. I don't know what you think, Tricia or Matt. I think that's a legitimate question to ask.
Totally. In that situation, somebody says, I don't want to come back to work.
Why?
You say, may I ask why? Because we need to determine, you know, what the reason is. I don't want to tell you. Okay, well then we're going to just we'll separate your employment and we'll characterize it as a voluntary resignation. I mean, that's the conversation. If they really won't tell you, then okay, we've offered you your job back. You don't wish to come back. You don't wish to have a discussion about why. That's fine.
And just from the standpoint, you want to know if there's something in particular about the workplace that the employee is objecting to or has a problem with. I think that's something that you would want to know in advance, just because who knows what, you know, you certainly want to know, is it because the person is scared? Is it because the person has a medical condition? Now, I'm not saying you should come out and say, well, why don't you want to come? Is it because you have a medical condition that prevents you from coming? No, I don't. That's not something you should ask. But certainly, I think you should try to find out what, any time an employee doesn't want to come back to work, I always think it's a good question to ask whether or not it has to do with, you know, whether or not it has to do with COVID-19, just in general.
Hold on. I don't see any more questions. If anybody else has any more questions, it'd be a good time to submit them, as we've got about probably 10 to 15 minutes left.
Or we can end early for once, so we can break our record of going over.
Oh, hold on. Oh, here's a question. This goes back to the OSHA investigation requirement. How would an investigation begin in the healthcare industry, and can we ask about other jobs they might be working? Well, I mean, I could start the answer on that. At beginning the investigation, I think, is always going to start with a discussion with the employee. I mean, there could be some exceptions, but generally you're going to ask the employee about the circumstances of their illness, when they started to feel ill, what they were doing in the days surrounding that, if they've been to large gatherings, if they were around anybody that they were aware of that had COVID-19, including coworkers. So I think you're going to start with some open-ended questions about who, what, when, where, and why. And then I think really the circumstances are going to dictate the follow-up questions, meaning every investigation is going to be different. I think you've got, to the extent that you're conducting an investigation in the healthcare industry, I think that's probably going to be pretty tough, which illustrates the difficulty of this OSHA requirement, because in the healthcare industry, I imagine that there's probably the highest probability of exposure to COVID-19 with treating healthcare providers, nursing homes, hospitals, acute care facilities. You're probably going to have exposure to COVID-19 in all of those types of situations. So it could end up being that you determine that it's more likely than not, that the exposure to COVID-19 did come through the workplace. Can you ask about other jobs? sure. I mean, I don't see, there's nothing that would prohibit you against asking about other jobs, and maybe that'll be one factor that weighs against a finding that it's more likely than not that the employee contracted in the workplace. But I think in the healthcare industry, certainly that's going to be difficult, especially with the low threshold. Just is it more than likely that it was contracted at the workplace? Well, certainly if that employee's been around other employees or patients or treaters who have had exposure to COVID-19, certainly could weigh in favor of a finding that it was work-related. Do you guys have any thoughts on that?
I just keep thinking about workers' comp. So at the beginning of this, we were all speculating about workers' comp and saying, how are you going to show causation? Well, OSHA is saying show causation. So the question is, I mean, for many people, luckily, thank goodness, it does not become, a long-term illness. I mean, for some people, sadly, it's a tragic illness that results in death. Some people, it's a short-term illness that they recover from quickly. And then there's a middle group of people who have long-term sequelae from having had COVID. My question is, are those people going to apply for for workers' comp? And, would they get it? And I have not seen yet any workers' comp claims related to COVID. I don't know if there are any out there. Personally, I've not seen them.
I know there was a state, there's a state, I think it's Illinois. I know that doesn't apply here, but I get the sense that this is something that we're going to see more of. Illinois has this presumption that a first responder or a frontline worker or a healthcare worker who contracts COVID-19 basically contracted it in the course of employment while working. So that's something we might start to see just to avoid these causation issues, having to establish causation.
Yeah,
right.
And the burden.
They want, to support the frontline workers in getting unemployment, so that it doesn't become a 9/11 situation where they have to go to Congress and beg for money. I mean, I think that's actually a good public policy decision. Right. I just haven't seen that in Connecticut. I'm surprised other states are not following in line with Illinois. Maybe it's interesting. I have not seen
I think that it is starting to spread to some other states where there are some rebuttable presumptions. There have been some constitutional challenges to those types of laws. So I think there's going to be fits and starts about these rebuttable presumptions for unemployment purposes. But it's certainly something that we're starting to see percolate on the state level. What
do you guys think? What do you guys think of the situation where someone would try to sue their employer outside of workers' comp, because claiming that the employer did absolutely nothing to mitigate the risks of COVID, of COVID in the workplace?
Right. And would be right. They get the workers' comp bar by show intentional.
Right.
Standard. That's a tough standard.
Yeah, it's a very tough standard. But I could see. I could see some plaintiffs just giving it a shot, which is why I've been telling people just, basically do what you need to do so that you can later establish, if you ever had to, that you took measures to mitigate COVID-19.
Right. Right. I totally agree with you, Sal, because plaintiff lawyers are going to be trolling for cases out of this, and that's going to be one way around the workers' comp bar. The other thing I was thinking is premises liability. So, if we work in an office and we say, okay, well, the landlord didn't clean the building, so I think I got it on the elevator. I mean, that gets around the workers' comp bar because you're not blaming your employer, you're blaming the landlord. We'll see. Are these things going to happen? They may.
So we've got a number of questions, and I think I've got time for maybe two more here. And one of them, and I like this question. I think that we'll have some nice discussion about this. So in preparing to return to the workplace, what if an employer doesn't have proper cleaning supplies or sanitary supplies for employees to return to work? What do you do in that situation?
Buy them. I'm sorry, did I say that out loud?
I don't think you can. I mean, I know for offices, before you could open on May 20th, you were supposed to fill out the state guidance that you're in compliance with the rules and regulations. And if you can't comply, then you're not going to be able to open. So
Yeah, I think you're also setting yourself up for lawsuits that while employees might not ultimately be successful, you might be paying a lot of defense costs or large settlements because employees will say that they contracted COVID-19 at the workplace due to your unsafe conditions, your unsanitary workplace, or you might have OSHA enforcement investigations because you have an unclean workplace that's not compliant with CDC or state guidelines. So I would really suggest that if you do not have the reasonable cleaning supplies and sanitary wipes and hand sanitizer available for employees, you're not ready to reopen.
That's right.
right.
Another question that I like here is, so let me try to frame this one. So this is a situation where the workplace, everybody's working 100% remote right now. When the workplace reopens and they start to bring people back to the office, what if somebody says that they're not comfortable coming back in? Do we have to let them work at home going forward remotely now that we know that individuals can perform work at home? Is it going to be a requirement going forward?
That's a great,
the argument
that's a great question.
You were able to do it during the pandemic, so why can't you do it for me now?
So there's two parts to that question. The first part, to me, best practice is if you're in an office environment and your staff has been able to work, your employees have been able to work remotely, I personally don't see any reason to force people back to work right now.
No.
If the productivity levels have remained high, and so to me, the best practice is you can reopen. First of all, you can only reopen at 50% anyway. And so then you say to people, make sure that you're going to maintain the 50% threshold. And so that means not 100% can come back 100% of the time. And then, if 100% want to come back, you logistically have to figure out how you can only maintain 50% capacity. And then, and one good way to do that is, again, to take a survey and to find out how many people even want to come back. So my view is, number one, you can't have 100% people back in an office environment right now 100% of the time. So that's a non-starter. But if you want to reopen and have 50%, then you need to figure out how to do that. And if somebody doesn't even want to come back and work in the office 50%, my question to you is, why are you having people come back? So if you can, if you can articulate legitimate business reasons like productivity has fallen way off, and so we need everybody back in the office, okay. But if that's not a reason, and there's been a really good success rate of remote working, that's the business question. Then we have the accommodation question. Now, the accommodation question, in my view, the world has changed, because it used to be, was a defense to say, well, we can't do this job remotely. This person cannot telecommute. If somebody's asking for a medical, an ADA, disability accommodation, they have to have a disability. And so the accommodation they're requesting is telecommuting. I think it's going to be impossible to refuse telecommuting as a legitimate disability accommodation now. Sal?
Right. No, and I agree. But absent that, and while you may want to continue to allow your employees to work from home, which is great, working remotely, you're not obligated to. All right. So that's something that, I think is pretty clear. You're not obligated to let anybody work from home unless we're dealing with a reasonable accommodation situation due to a disability. And under those circumstances, I agree. It's going to be a lot harder nowadays to show that you can't grant an accommodation to allow an employee to work from home a few days a week.
You know what I think is so interesting right now? We never had to accommodate for age. And so if someone says,
Right.
I'm 65, I want to keep working remotely, you know, and you make everybody else come back to the office, I mean, you're basically giving that person an
That's
accommodation
right.
on the basis of their age.
That's
So
right.
I guess you could reframe
Good
it
point.
and say, no, I'm giving them an accommodation on the basis of their vulnerability and susceptibility to COVID, which correlates with age, but it's really more of an
Right.
ADA thing because of the medical condition. And if they get a note from their doctor, you can frame it more under the ADA, because the ADEA, the Age Discrimination Employment Act, does not require accommodation
right.
for age, but
That's right.
you're gonna lose
But
it,
the
so.
EEOC does address this in the recent
Oh, what's it
recent
say?
guide.
Okay.
It does. And it says, you know, in many cases, when you're dealing with someone over 65, they're probably, or no, I shouldn't say probably, but there may very well be an underlying or comorbidity, an additional medical condition that would qualify as an ADA disability. But yeah, so that's right. That's interesting. There is no obligation to accommodate someone based on age. But I agree, in this case, age is what makes you maybe susceptible or you know, susceptible to a real serious condition.
So another question that we had, and this might be it to close it out. I know that we have a few others that I haven't answered, but I think this is a good question, and I've got several different people have asked this question. So for reopening safeguards, when the state or the CDC references 50% capacity, does that mean 50% of your employees or your head count, or does it mean 50% of the space, the capacity for that particular space, meaning fire code? You know, my understanding is that it's 50% of capacity, not 50% of your head count.
That's right. I agree with that. Right.
Yeah.
It's all about it's all about it's not so much about how many people can you put back to work. It's about how many people can you put together at one time working. So it really is an issue of capacity.
I think too, you have to be careful there, because it depends on, you know, the density issue was different pre-COVID. So it may be that you have capacity in your office to squeeze in people like sardines. But if you don't have, but post-COVID reopening, or, you know, now reopening, you have to ensure that there's enough space for proper social distancing. So if you have a very tight office, you really have to think about, you know, how are we going to ensure that people are not squeezed in together right on top of each other?
That's true.
Are we going to, you know, put X's on the floor to show what a 6-foot social distancing space would be? I mean, I've had offices do that. I've had offices take very, you know, like the supermarkets have done, take very explicit steps to ensure that there's social distancing in the office. So you really have to think these things through. What environment am I bringing people back into?
Mm-hmm.
So we're right up against 1:30 at this point. I appreciate everybody's questions today. Thanks for the audience participation. That's exactly what we wanted. I'm sorry we didn't get to answer everybody's question. You can feel free to reach out to us after the presentation if you have discrete questions that you'd like to follow up on. But we really appreciate everybody's time. Hopefully we'll do this again soon. But Tricia, Sal, thank you for participating.
Thank you. Thanks for emceeing, Matt.
Yeah,
Okay.
I hope this was worthwhile and provided value for everybody on the call. So have a nice day.
Thank you all for your questions.
Thank
Great
you.
questions.
We'll see you next time. Take care.
Bye-bye. Bye.